Diego Ruiz Dasilva, and I'm a board-certified dermatologist working for Forefront Dermatology, as well as an assistant professor at the Eastern Virginia Medical School in Norfolk, Virginia. Yeah, so my talk this year was on JAK inhibition in dermatology with a focus on atopic dermatitis, but in terms of identifying the ideal candidates or risk stratification. There's a huge issue right now, I think, in JAK inhibition, particularly in the United States, sometimes around the world as well, about the boxed warning. It mentions the increased risk potentially for MACE, malignancy, and VTE. And that data, or that warning, is extrapolated from tofacitinib for rheumatoid arthritis patients from the oral surveillance study. And because of this, there are a lot of clinicians who feel very comfortable with the efficacy and understand the deep endpoints that JAK inhibition can achieve for many of our dermatologic disorders, but they feel uncomfortable prescribing it with the fear that either they will cause some of these side effects or even patient perception, being upset that they were giving something with a warning or something along those lines. So we reviewed the data that's out there from all the clinical trials for many years amongst many of the drugs approved. We show how the rates of MACE, malignancy, and VTE are often the same or lower in the patients treated on drug versus placebo groups or versus real-world cohorts of folks that are matched with the same diseases, let's say moderate severe eczema in this situation. And we go through practical pearls on how to use the meds in clinic, how to dose, how to monitor labs, and how to speak to patients about the benefits and risks, including this boxed warning. So it's a great session. Excited to be talking about it. Yes, we had a great poster this year, Jonathan Silverberg, myself, and others, looking at upadacitinib and the results from the Measure Up trials and seeing what exactly the deep endpoints or how exactly you can get patients to the ideal patient-reported outcome measures, right? So whether that's sleep, whether that's anxiety, overall dermatology life quality index, we're able to show from that study that patients who get at least an easy 90 and an itch of 0 or 1 are much more likely to have a low level of impact on their quality of life, on their sleep, on their anxiety and depression. And at the end of the day, that's what we want for the patients, right? Of course, we want skin clearance, we want itch reduction, but if that doesn't translate into an improvement in their life, then what really are we getting at? And so I think we're entering this world with so many therapeutics and so many great options, where I think that we're gonna need to stratify on which ones are basically giving our patients their life back and making them live a fulfilled life.